First of all, obviously I have to say thank you to our entire HPHA team. The way that people have been stepping up, the approach that they're taking to not only the care we provide, but to the relationships we have with each other has been absolutely phenomenal. We also need to say thanks to everybody else, all of our healthcare partners, our communities. This is certainly touching everybody. People are stepping up in any way they can. We will get through this. We absolutely will. And I know our group and our team is doing absolutely everything we can to make sure that happens. We know firsthand the impact of COVID-19. Our team responded with empathy. Our team responded in a way that we would come to expect. Make sure we choose knowledge over fear. There's so much information out there, and we really have tried hard as an organization to be clear and consistent in how we're dealing with this. Our true north in responding is Ontario Health, the Provincial Medical Officer of Health, our local public health unit, led by the incredible Miriam Clausen, and our internal infection prevention and control practitioners. PPE will be a major focus for this organization, and we're trying our best to make sure we have absolutely what we need. We do need to be responsible, though, and we are putting measures in place that make sure that as appropriate we conserve, but we never put conservation ahead of safety. We're getting a ton of stuff from the community. We're getting donations daily, and every single donation we get is appreciated more than we can put into words. So we really want to reinforce the important role that we all play in moving us through the COVID-19 situation. We've heard a lot about physical distancing and the need to make sure we flatten the curve or plank the curve, but the message really is that we get through this quicker based on individual behaviors. And we need to reinforce that. You know, if people aren't social distancing, I shouldn't use that word, physical distancing, then they're basically putting all of us at risk. Putting all of us at risk in the short term, the midterm, and the long term, whether it's the healthcare system, whether it's local businesses that have had to close for the short term while we work through this. So it's really important that we, as we deal with our own reality, as we support those close to us, that we also reinforce the importance of what we can do as a community to address this. You know, and as I said right at the beginning, we will get through this, and we will get through this by working together, by supporting each other, by understanding that we are all accountable in contributing to the success that we're going to have. And you've all heard the phrase, many hands make light work. Well, I'll conclude this brief video by simply saying, many clean hands make light work. Thanks to the HPHA team for the fantastic work you're doing.